January 3rd, 2020. Chinese public health officials sent a report to the World Health Organization about the Wuhan pneumonia cases. Already, 44 people in Wuhan had come down with pneumonia symptoms, and doctors hadn't yet been able to identify the cause. The World Health Organization, or WHO, is an international organization formed by the United Nations that tracks evolving infectious diseases around the world, ready to sound the alarm to protect us all from emerging epidemics. The next day, the WHO tweeted about the cases. Hashtag China has reported to WHO a cluster of hashtag pneumonia cases with no deaths in Wuhan, Hubei province. Investigations are underway to identify the cause of this illness. They told countries around the world to start taking extra precautions against respiratory diseases, and a team of WHO investigators headed to Wuhan to help solve the mystery. 11:20 a.m., January 8th, 2020. Li Wenliang bent in close to examine his patient's eye. As he did, she started coughing. "Oh, excuse me, doctor. I'm afraid I have a cold. I would have stayed in bed today, but I didn't want to miss my appointment with you." The patient apologized in between coughs. "No problem. Now, can you read the letters on the chart against the wall for me?" Dr. Lee continued the examination. January 9th, 2020. Doctors in Wuhan fought for the life of a 61-year-old man infected with the mysterious pneumonia, but the infection-fighting medicines, ventilators, and other supports couldn't save him. He died that day, the first victim of the new disease. He had been a regular shopper at the Huanan seafood market. When Lee heard the news, he thought about Dr. A.I. Fenn and his other friends who worked every day in the emergency wards and the danger they faced. Already, the medical staff treating the cases of pneumonia at Wuhan Central Hospital were swathed in protective equipment, and the patients were kept carefully isolated from others. Were those protections enough? Epidemiologists were kept busy day and night tracking down everyone who had been in contact with one of the pneumonia patients. They needed to know if the disease was spreading, and if so, how fast. The citizens of Wuhan were warned to protect themselves by staying home when they could and wearing masks when out in public. Drugstores quickly ran out of face masks and gloves as people rushed to buy up all they could find. Meanwhile, the scientists searching for the source of the disease looked anxiously at their calendars. The Lunar New Year was approaching. Every year during this major holiday, millions of people would head out across the country to visit their families. Because Wuhan is a transportation hub, many travelers would be boarding planes, trains, or buses in the city. The scientists knew they needed to determine whether the mysterious illness could be transmitted directly from person to person. If it was contagious, they had to get a warning out in time, or the epidemic could become uncontrollable. January 11th, 2020. At last, Chinese scientists found the answer to the question that all of Wuhan was asking: what was causing the outbreak? The source of the illness was a virus in the same family as SARS, a coronavirus. Coronaviruses are named for the way they look, as though each tiny round virus is wearing a crown. Corona is the Latin word for crown. Coronaviruses are very common, and they cause diseases in both animals and humans. Most of the human diseases from coronaviruses are mild, like the common cold. But what the scientists had found this time was a completely new virus, one that had never been seen before. Already they knew that it could be lethal. In the report sent to the WHO and other public health agencies around the world, the scientists referred to their discovery as a novel or new coronavirus. Not only had they succeeded in identifying the virus, the scientists were able to report that they had already sequenced the genome of the virus. This meant that they had gathered specific information about the virus itself and how it was constructed. Knowing the genetic makeup of the virus would help scientists to develop accurate tests for the mysterious disease. This was crucial in the race to understand the novel coronavirus. But scientists in China and with the WHO knew there was much more they needed to learn about their new enemy. As they continued to study the disease, they began to put together the picture of what happens inside someone infected with the virus.